Hi, I'm Deb Kimmett, and this is the news brief for June 20th, 2022. In this video, we cover the developments that have occurred over the last month that pertain to massage therapists. This month, we'll cover our usual updates on the variants and long COVID, and we'll have updates on Paxlovid, Rebound, and mask mandates. Yes, they still are a thing. And we'll also talk about breakthrough cases, the vaccination of kids, and some other news on vaccines. And we'll talk about how COVID is upending other viruses. And since it's big in the news, we'll spend a little time on monkeypox. So let's get started. A shout out goes to the Massage Health Practitioners and COVID-19 Facebook group. They provide accurate, evidence-informed info, and I want to credit them for a job well done during the pandemic. You'll notice at the bottom of the slides, I have an abbreviated source. The full citation is in the companion PDF file, or what I like to call the show notes. And before we get into the topics for today, remember, science changes. So what we know today may not be what we know tomorrow. This means that the information presented here will evolve and change as we learn more. And for the usual disclaimer, the information contained in this news brief is informational only. It's not to be considered as medical advice, nor should it be construed as medical advice. So on to our first topic. A recurring topic is the variant update. The Omicron subvariants are still dominant. As of June 11th, the two BA2 subvariants make up most of the cases, about 78.4%, whereas BA4 and BA5 make up the other 21.6% of cases. This is up from the previous week's total of 13.1% of cases. So BA4 and BA5 continue to gain steam. Last month, I reported that scientists seem to think that BA4 and BA5 could lead to a new wave. Instead, what we're seeing is that as of June 15th, cases seem to be flattening out instead of increasing. But as I've reported before, that could be attributed to people using the over-the-counter rapid antigen tests and not reporting their findings. What is telling, though, is that the hospital admission rates are continuing to tick up. So we'll see whether or not this develops into a full wave or not. What can we take away from all this? While we are seeing fewer masks and people want to be done with the virus is not done with us. Hospital admissions are ticking up, indicating that a wave may be on the way. We'll know more in the fall when people are in closer quarters, which tends to lead to more transmission. For now, as long as you keep your precautions in place, there's no need to be overly concerned about the variants at this time. The second topic concerns breakthrough cases. Remember, breakthrough cases are those COVID cases that occur after a person's been vaccinated. A new large study came out over the last month, which studied over 114,000 vaccinated people to compare the breakthrough rate of people with HIV versus people not infected with HIV. But it also showed a couple of interesting things too. Researchers found that the general rate of breakthrough infections is fairly low, about 3.9%, and they determined how the vaccines fared when compared with each other, which it wasn't much different from each other. Moderna provided the best protection from breakthrough cases at 2.8%. Pfizer was next, and J&J had the most breakthrough cases at 5.7%. And finally, or firstly, because that's what the study was about, we learned that those with HIV were 28% more likely to have a breakthrough case than those not infected with HIV. The massage therapist takeaway: this is just one study and more are needed. However, the numbers of breakthrough cases appears low, 3.8% overall, which generally should provide a bit of a sense of relief. Even though there's a caution here that this is just one study, I feel better. But even so, be vigilant about your protocols because the possibility is still there. Comparing vaccine effectiveness, there appears to be little difference between the vaccines. But the thing here is that it's not so important which one you get, but it's much more important that you get one if you can. And if you want them, get vaccinated and boosted, as they generally prevent infection. There is a caveat here. Breakthrough rates against the subvariants BA2, BA4, and BA5 is not clearly known at this time. And finally, HIV clients have a significantly higher chance, 28%, of getting a breakthrough case, so should be extra careful. Inform your clients if they already don't know this so that they can be protected. And our mask mandate update is to update on this topic from last month, where I reported that a federal judge overturned the mask mandate on federal public transportation. I reported that letting the decision stand would be harmful for public health by setting a horrible precedent. Such a mandate is within the CDC's authority, and if they can't exercise their authority, we would all be in trouble when the next pandemic hits. The Department of Justice has finally filed an appeal in court, taking the CDC's side on what is within its statutory authority. We'll see what happens next. The massage therapist takeaway: the CDC's authority to impose mandates is necessary to protect public health and safety. The DOJ is appealing a court ruling to ensure that this power is not taken away or diluted. And as an aside, the numbers are ticking up, and we know masks are important to stop the spread. So it's not time to unmask yet. Last month, I reported on Paxlovid Rebound, where symptoms returned shortly after taking the antiviral Paxlovid. Nobody knew how prevalent it was because doctors were starting to see more and more cases of it. A small study came up this month of around 500 patients treated with Paxlovid, and that showed a very small number of patients experienced Paxlovid rebound, less than 1%. This is in line with the study that I reported on last month that reported a 2% rebound rate. And something about this study is that all of those who rebounded had comorbidities like obesity, cardiovascular issues, or other health problems. But all patients recovered without undergoing another round of the drug. The caution here is that this is just one study and it's very small, but so far indicators show that the problem may be not as prevalent than people are thinking it might be. The massage therapist takeaway: Paxlovid is safe to take. Check with the physician to make sure it's right for you. Paxlovid rebound appears to be rare. Again, this is one small study, and more study is needed. But be aware that if you are obese or have health problems, this puts you at a higher risk. And just to reiterate what I said about the topic last month, if your clients have taken Paxlovid and they're experiencing a rebound in COVID symptoms, send them back to their doctor. How this might happen is that they're wondering and asking you if it's okay to come in, or you may be wondering if it's okay to go back to work and you're showing symptoms. It's not okay. Also, if you've taken Paxlovid, Catalina recommends rapid testing after you finish the course of treatment on days 2, 3, and 4, before ending isolation. And we have good news about vaccinating kids. Finally, vaccines for kids 6 months through 5 years old jumped through its final hoop and were approved on Saturday, June 18th. Vaccines will be in use this week. Both Pfizer and Moderna vaccines in younger kids aged 6 months through 5 years old were approved. J&J is not approved for use. This means that the only age group not eligible for vaccination is those younger than 6 months. As far as the regimen goes, for Moderna, there are 2 shots, 3 weeks apart, in kids aged 6 months to 5 years. For Pfizer, in kids aged 6 months to 4 years, there are 3 shots, 3 and 8 weeks apart. And for kids 5 years old, Pfizer has a regimen of 2 shots, 3 weeks apart. The trade-off for the younger group is that Moderna is 2 shots versus 3 for Pfizer. And it takes 3 weeks to be done with Moderna versus 11 weeks for Pfizer. But early data shows that the Pfizer vaccine regimen is more effective in kids. So the main trade-off is effectiveness versus convenience. So that's for the younger kids. As far as the 6 to 17-year-olds, we're still waiting final CDC approval for the Moderna vaccine for kids that age. It's been FDA approved, but not by the CDC. The CDC will be discussing this on June 23rd, so it's likely to be fully approved soon. Pfizer has already been okayed for a while, and Moderna's, once approved, would be a second vaccine choice for the under 18 age group. The only other issue with kids is booster shots. For 12 to 17-year-olds, Pfizer has already been approved to provide a booster 5 months after the final dose, and a second booster at least 4 months after that for those who are moderately or severely immunocompromised only. Moderna's isn't there yet, as even the primary doses haven't been approved yet. For the 5 to 11-year-old age group, Pfizer was approved this last month to provide one booster for this age group, given at least 5 months after the final dose of the primary series. Again, Moderna is not there yet. And finally, for kids younger than 5, no boosters are recommended for any of the vaccines. The massage therapist takeaway: kids 6 months and older can be vaccinated. For younger kids, those under 5, Moderna is more convenient, but Pfizer is more effective. The Pfizer booster is available for those 5 years old and up, and getting a booster protects you and your clients because there's a lower likelihood of kids transmitting the virus to their families, and there's more protection for kids as it helps prevent reinfection and the severity from reinfection, as COVID is now a leading cause of death among children. It's a myth. It's simply a myth that it's not. And just today, polls show not enough kids are going to get vaccinated. So Jetalina released information as to how you can talk to clients about it and other information. The link is in the show notes. So experts encourage it to protect against severe disease. And if you can and you want them, vaccinate those kids. Pretty much vaccines for kids has been sucking up all the airtime in the press, but there are other items of note in the vaccine world. Moderna is moving along with development of their specific vaccine for the Omicron variant and have submitted it to the FDA for approval. It was developed specifically for BA.1, the original Omicron variant. Moderna thinks it'll work against all the variants, but there's no evidence to back it up. And on another front, immunity of older Americans is waning, and they're not getting boosted at the same rates that they did when the vaccines first became available. So when the Omicron virus and its variants came along with its higher rate of contagion, this lack of keeping up with the boosters has increased death rates among older Americans 65 years and older. The massage therapist takeaway: keep an eye out for Moderna's new Omicron-specific vaccine. It may show up as a booster later on. And when you inquire about your client's vaccine status, encourage your older clients that have been vaccinated to follow up with their booster for more protection. We're also seeing some news about COVID upending other viruses. Researchers are seeing other viruses behaving differently than before. For example, the flu virus is moving out of being seasonal. It's not just in the winter, but is moving more into the spring. There's a lot of speculation as to why, and is something researchers are studying. The massage therapist takeaway: viruses are behaving differently because of the COVID pandemic. Flu season is currently shifting towards spring. Be aware that clients may be more susceptible to the flu and other viruses at other times of the year, not in their typical timeframes. Before I get into the last topic, which is our long COVID updates, I want to talk about monkeypox. Typically, these updates are exclusively about COVID-19, but since monkeypox has exploded on the scene, I want to talk about it. So here's the basic skinny. Monkeypox is going to be renamed by the World Health Organization at some point because the name is stigmatizing, discriminatory, and racist. The window that a person can be infectious can be for several weeks. A person can be contagious, quote, from the time the symptoms start until the rash has fully healed and a fresh layer of skin has formed. This can take several weeks, unquote. So what are the things we need to look out for? What are the symptoms? Fever, headache, muscle aches and backache, swollen lymph nodes, chills, exhaustion, and within 1 to 3 days after the appearance of a fever, a rash appears, and that's the pox part. Those are your symptoms. People come to us for headaches and muscle aches, so we could be exposed and not know it. You basically won't know until after the fact. That's why it's important for us to check people for fevers. And as a Massage Magazine article on monkeypox says, working on someone with a fever is contraindicated. So following that guidance is important. Just so you know, During the incubation period, which is before symptoms show up, a person is not contagious. And if you think you've been exposed, you won't be contagious to your clients until you start having symptoms, which can take anywhere from 5 to 21 days. Usually it's 7 to 14, but be aware for the next 3 weeks. Transmission occurs by direct contact with lesion material or other bodily fluids, respiratory droplets, and aerosols from prolonged close contact. And the CDC defines that close contact as being within 6 feet. Doesn't that sound familiar? And transmission also occurs by indirect contact, by touching items that have been contaminated by the infected person, like sheets or clothing. Touching or coming into contact with fluids or things that the fluids are on seems to be the main mode of transmission. The respiratory aspect sounds very similar to COVID-19, but it doesn't appear to be as contagious as COVID-19. The experts say that prolonged contact is necessary and it takes a large viral load to contract, but it's not clear what's driving the outbreak. However, it gives me pause when the CDC recommends, quote, other household members should wear a respirator or well-fitting mask when in close contact, for example, within 6 feet, with the person with monkeypox for more than a brief encounter. As of June 17th, there have been 131 cases in 21 states, and they seem to be clustered in California, Illinois, Florida, and New York. As far as whether we should be worried, only time will tell. The massage therapist takeaway: watch for fever in clients. This is a contraindication for treatment anyway, so this should help protect you. Watch for the rash. Follow your usual protocols and mask up. If there's a suspected exposure, just remember these 3 main points to guide you in whether or not you or your client are contagious. In the incubation period, which is up to 21 days, you're not contagious. The moment symptoms appear, you're contagious, so you want to watch out for those symptoms. And you're no longer contagious when the rash is fully healed with a new layer of skin formed over it, which can take several weeks. And finally, for our long COVID update. Most of the press on long COVID, or PASC, was a rehash of old news with a few new things thrown in. The American Academy of Physical Medicine and Rehabilitation released a consensus statement. The guidance was intended to raise awareness that long COVID can cause cardiac issues, especially in those who didn't have a history of cardiac issues prior to their COVID infection. This issue is something that we already know about, but the AAPM&R releasing the paper is significant because it means that doctors are getting the message. The big news on long COVID this month is that there's more evidence that long COVID can occur after a breakthrough infection in vaccinated people. It's based on a large study using data from the Veterans Administration. In the breakthrough cases, nearly 1/3 developed long COVID, which is pretty close to the same rate of occurrence in unvaccinated vets who got COVID and then developed long COVID, which is 36%. So if this study bears out, we could say that the rate of long COVID is pretty consistent, whether you've been vaccinated or not. The only real difference is whether or not you get COVID in the first place, which in this study, only 1% of the 3 million vaccinated vets had a breakthrough case. As a caveat, the study was done before Omicron, which means that it's likely that these numbers are low. In all likelihood, they're probably much higher based on what we know about Omicron. The study's author is very concerned that vaccination doesn't protect against long COVID and that, quote, we need to urgently develop and deploy additional layers of protection that could be sustainably implemented to reduce the risk of long COVID, unquote. I can only speculate that what he's talking about are masking policies. There have been conflicting studies out of the UK, Israel, and other countries. Some show that vaccines help prevent long COVID and others showed it doesn't. This large study adds to that debate. Also this month, a CDC report came out that studied long COVID in the population generally. They followed over 2 million COVID patients until November 2021, which showed that 1 in 4 of those 65 and older developed long COVID, and those younger, 1 in 5 developed long COVID. These studies point to long COVID as being a significant risk. And yet another study based on 78,000 private insurance claims with a long COVID claim code found that nearly 76% of those patients were not hospitalized when they originally contracted COVID. The numbers covered only the first 4 months after the long COVID code was established and did not include government plans like Medicaid or Medicare, although it did include Medicare Advantage, which is private insurance. What this study tells us is that long COVID occurs in mild cases too, which is something we already know. The massage therapist takeaway: vaccination protects well against COVID-19, but if you get COVID, you are not more protected against long COVID. That means then that you can look at your long COVID risk by using that general stat from the study where 1 in 4 COVID patients over 65 years old are at risk for long COVID, and 1 in 5 COVID patients younger than 65 are at risk. Long COVID is also a risk for those who were not originally hospitalized for COVID, meaning that they had a mild or moderate case of COVID. And then finally, mask up and follow your protocols to prevent COVID and your risk of long COVID. And that's it for today. Thanks for watching. And again, please remember that science changes, so what we know today may not be what we know tomorrow. Stay safe and be healthy.